especially when it comes to Medicare Advantage plans, there's going to be a very different set of annual out-of-pocket maximum. So for newcomers, what that means is once your total cost, out-of-pocket costs reach that number, then it is the carrier's responsibility to bear the entire cost.
It's day 4 of our Medicare Annual Enrollment series, and today we're breaking down Medicare Advantage. These Part C plans are increasingly popular. More than half of all Medicare beneficiaries, more than 34 million people, now have such plans. But Medicare Advantage plans, they're pretty confusing. Today we're going to explain how they work, how they differ from original Medicare, and what to watch for in costs and coverage. Joining me to uncomplicate the complicated is Jae Oh, author of Maximize Your Medicare. Jae, welcome.
Thanks for having me, Bob.
Pleasure. So let's start with the basics. What exactly are Medicare Advantage plans and how do they differ from original Medicare?
Well, Medicare Advantage plans combine the elements of the Part A, Part B, which are inpatient hospitalization, as well as medical. And then in most cases, many cases, also include Part D, which is prescription drug benefits. From here, you have something called managed care, meaning that the plan provider, you become a member, it is determining the entire suite, all of the details of the benefits, which must be, on average, at least as good as original Medicare.
And my understanding is that these Medicare Advantage plans are operated by insurers, not necessarily by the government per se.
It is an important element that every year, Medicare Advantage plan providers, which are insurance companies, have to file and receive approval in order to offer their suite of plan or plans in a particular zip code. That's an annual process. So, yes, a key fact about Medicare Advantage is to know that an insurance company is the one that is determining what benefits you have inside your Medicare Advantage plan.
Yeah. So as we think about the year ahead, 2026 is bringing some big changes to Medicare Advantage plans. Are we looking at benefits that are being cut and insurance carriers that are leaving the market?
So certainly we've had some shakeup in the market as a whole. And this happens every year. It will seem more dramatic this year. The number of plans, while seeming steady, of Medicare Advantage plans nationally, I looked, the information was available this morning, that there is a slight decline. And underneath the hood, the details, if you will, they have weakened slightly. Your individual instance may differ, of course, your individual results may vary. For example, the idea of premium, while they're usually a $0 plan, meaning you have to be enrolled in Part A and Part B, but there is no additional premium, plans still exist. Nevertheless, what we have even inside here is a reintroduction, if you will, of deductible, meaning a health deductible or a drug deductible, depending on your plan. And so it becomes more challenging to understand what to do, how to choose based on your particular situation, the particular plan. You rightly pointed out that certain carriers have left entirely certain areas, and in certain locations, again, depending on where you live, that is creating some turmoil for a number of Medicare Advantage members.
Yeah. So is it fair to say that as folks go on to plan compare and look at Medicare Advantage plans in particular, that they may see fewer $0 premium plans? Is the zero premium era ending?
Well, I don't have a crystal ball, Bob. Mine's malfunctioned. But yes, to some degree, and it will not happen overnight, I don't suspect. But even in the plans and the carriers that we represent, I've noticed this, which is that the number of plans that are adopting extra costs, possible out-of-pocket costs for Medicare Advantage members has increased. I don't want to say it's all negative. It isn't, because of the fact that the intense competition in the world and in the marketplace keeps the carriers in line to the ultimate benefit of the consumer.
Yeah. I'm also told, Jay, that there are some new rules for people who qualify for Medicare and Medicaid, the duly eligible.
That is true. So this has gone actually back to 2025 this year, which is the ability to switch across plans is not as robust as it has been in the past. So it used to be that if you were fully dual eligible, you could switch frequently. Something wasn't exactly right, something didn't meet your needs for whatever reason, but that ability to change was almost unlimited to some degree. That now has some tighter bounds, is beyond today, but deep in the weeds, absolutely. It is not only that Medicaid eligibility has become strained, but it's also that if you are a Medicare and Medicaid person, that your ability to switch is also now a little bit more complicated than it has been in the past.
Yeah. So we mentioned that insurance carriers annually come and go in the marketplace. Plans change. Uh, for someone who opened their ANOC, their annual notice of change, and noticed that their plan was canceled or discontinued, what does that mean for those folks? Does that mean that they lose their Medicare coverage, or do they get auto enrolled into another plan, or are they just left hanging out to dry?
Well, it could be either one of two, which is that there's a piece of jargon called crosswalk, meaning that if a particular plan by a particular carrier is discontinued, that the transition process to another plan would be automatic in the absence of a specific action by the member, meaning that, let's just say carrier one discontinued plan A, they may carrier one may transition you automatically to plan B. If the carrier leaves the location entirely, then there's nowhere to transition to, in which case they would be returned to original Medicare since they had to be enrolled in Part A and Part B. And from that point, they have the right to select a different Medicare Advantage plan for 2026. In addition to that, there is then a special enrollment period, which allows people to adopt Medicare Supplement, otherwise known as Medigap, during this period, in which case they could select a Part D plan as well as a Medicare Supplement or Medigap plan available in your area.
Hmm. Well, that's good news. So no one's left hanging out to dry, presumably. So that's great. So Jay, in the many years that you and I have been talking, you've told me that beneficiaries should not focus solely on premium, that they should look at what their total healthcare costs would be. And tell us more about why they should do that.
Well, especially when it comes to Medicare Advantage plans, there's going to be a very different set of annual out of pocket maximum. So for newcomers, what that means is once your total cost, out of pocket costs reach that number, then it is the carrier's responsibility to bear the entire cost. The issue is that there is a boundary which the government sets annually, and Medicare Advantage plans, different carriers will offer different Medicare Advantage plans with very different annual out of pocket maximums.
Right. And so there may be cases where you're paying a monthly premium, but the maximum out of pocket cost may be lower than in another plan where there is no monthly premium, but a higher maximum out of pocket, in which case, if you're in bad health, you may end up paying a lot more for the $0 premium plan than you would for the $50 per month plan.
That is entirely possible, Bob. And every lever, every combination is in play here, which is that, for example, certain plans have combined in and out of network out of pocket maximums. Certain plans have separate ones, meaning that if you use an out of network provider in a PPO plan, you may then be faced with a very different annual out-of-pocket maximum. These are nuances that some of it is not easy to tell in advance, meaning that there's randomness involved, health event, for example, that you did not foresee. For other people, however, it is known. For example, you may have a condition that you know has to be monitored and tested in a very specific way. And you also therefore know that you may be able to choose a particular plan to optimize your total out-of-pocket cost, which also includes premium plus the out-of-pocket cost you pay for a particular set of services.
Yeah. So bottom line, choose based on your health, not on your premium. We're going to take a quick break. And when we come back, we're going to give you a step-by-step checklist for Medicare's open enrollment period and the deadlines you can't afford to miss. Stay with us. Welcome back to Decoding Retirement. I'm speaking with Jae Oh, author of Maximize Your Medicare, about Medicare's annual election period, or open enrollment period is often called that as well. We're talking about Medicare Advantage plans. There's lots we have to get to, Jay. I want to talk about copays and coinsurance and annual deductibles and what folks need to know about that as they enter this annual election period, open enrollment period.
So copays are a fixed schedule, meaning that you pay a dollar price for a particular service. When it comes to prescription drug plans, a particular tier may have a specific dollar amount. And the reason that it's become complicated is because from plan to plan, these copay amounts may or may not apply to a deductible based off a service. So if you have test one, it may have a copay or coinsurance amount, but by plan, they'll be telling you whether or not this counts before the deductible, if it has a health deductible, for example, or not. Now, it's really deep in the weeds here, Bob, because people like me, when we are telling persons or asking people about what they are looking or what's important to them, is that individual plans cannot discriminate. They cannot discriminate based off a particular health situation. There's a lot of crossfire and talk about people who are involved in the insurance business. And that is not one for me, meaning that no carrier will deny entry into a Medicare Advantage plan based off your healthcare needs.
And then with coinsurance, that is a term that I think people maybe not have a good understanding of. My understanding of it is that you may be forced to pay 10% or 30% or some X percent of the bill based on the coinsurance amount.
That is true. That is a fixed percentage, again stated in your plan documents, which means that if you use an out-of-network provider, for example, in a PPO, you may have a co-insurance percentage where you are responsible for that percentage.
So many beneficiaries choose a Medicare Advantage plan because of all the extra goodies that are offered to them: vision, dental, hearing, and the like, silver sneakers. Should they consider that in their decision making?
Well, that depends on the person. And of course, I could say that for basically all the questions that you ask, but it depends. Uh, that certain people, will put a high priority on a lot of these extra benefits, where silver sneakers is certainly one that many people know about. What I find is that the dental and vision and access to extra benefits, even if you had to pay for them, may be worth it for some people. For example, just the easy example would be that you've turned 65, you are Miss Perfect in every way, you don't have medications or medical situations, your healthcare needs are really low, but you have huge dental costs. In certain cases, literally it can be, because I have actually executed this, which is that to then, in that comparison, since the plans are so similar, but one has access to a dental plan which has more robust benefits, can that be the reason? It can be. So so while we are seeing, without question, we're seeing a dilution, a reduction of some of these extra benefits at the margin. I don't want to say that they are without value, especially in a particular person's case.
So as we think about, we're now at the start of the open enrollment period, and we think about what beneficiaries can and can't do during this period and when they should do it. There's a certain list of things. They can keep their plan. They can switch between MA plans. They can move from original Medicare to Medicare Advantage, or they can move back from Medicare Advantage back to original Medicare, or they can switch or drop Part D plans. What do you tell people about in terms of what they should do and when?
Well, certainly between now and December 7th, they have the unrestricted right to select and enroll in any Medicare Advantage plan. They can do this an unlimited number of times through December 7th. The last one that someone would select is the one that would be in effect for January 1st. I did want to mention that even after December 7th passes, that existing Medicare Advantage plan members have additional right during the first quarter of 2026 to switch once amongst plans. So if you discover somehow, or for some reason, that your doctor has moved out of network for your particular plan, and then you wanted to change it, that is still possible. So while it is unlikely that, because the numbers tell me that not lots of people change during Q1, during that second bite of the apple, if you will, but still it exists. So I would still suggest to people do their due diligence, however they can do it, but do it to try to get the optimal plan for themselves as expected, but yet still know if some unexpected event or unexpected fact comes to light, there's still Q1 of 2026.
Yeah. So we've covered all the do's. Before we wrap up, I want to just cover a couple of the don'ts. And you've told me many times that people who are inclined to move away from Medicare Advantage back to original Medicare and maybe sign up for a Medigap plan ought to do what?
I think the main thing here, Bob, is the sequence, which is that some people may have lived or moved to a location where no matter what they do, that the network is too fragmented to manage. This can be understandable. If you are trying to move from Medicare Advantage to a Medigap plan and original Medicare, this is the time to do it, but you do need to pass Medigap underwriting first. The reason is that if you, let's just say you did it in the wrong order and you elected a Part D plan, it would auto eject the incumbent Medicare Advantage plan. So now you're in Medicare Advantage Plan A. You apply for Part D number 3. That will replace Medicare Advantage Plan A. If afterward you are then rejected by Medigap because you fail underwriting, now you have Part D alone without any extra benefits other than Part A and Part B of original Medicare, meaning you have an unlimited out-of-pocket maximum for healthcare costs. That is the setup that I'm trying to emphasize all of these years. You've been so good about having me, Bob, to try to avoid this pitfall.
Yeah. And the last don't I want you to address, Jay, has to do with shady marketing. For many, many years, some of the marketing around Medicare Advantage plans has been shady, so to speak. And there are new rules in place, and that people should be aware of these rules so that they don't fall victim to marketing scams.
I think this just means, applying your common sense first. meaning that outgoing calls, you should not be receiving an incoming phone call unless you have specifically requested. That I don't call random person number 3000 just because I feel like it, because I've seen their number and they're Medicare eligible. That is not allowed. So that is number one. The second thing, and this is what I would apply for all insurance, all, which is if someone calls you and you're talking to them and you're asking whether or not that is a legitimate producer, the simple question can be is, what is your NPN? And that is National Producer Number. It is a unique number. I have one, as well as all licensed p- people involved in insurance, whether or not that insurance is auto insurance or health insurance. If a person's not willing to share that with you, that could be, you a red flag number 1A for me, meaning that I can never get away from. And so if I'm a legitimate producer, I'm absolutely willing to share to that. So if someone is unwilling to share that with you, that should probably tell you something.
So, Jay, we've run out of time for this episode, unfortunately. We packed a lot of great content into it, and we've helped a lot of people, I believe. So I want to thank you for sharing your knowledge and wisdom with us. Greatly appreciated.
Always my privilege to be with you, Bob.
And don't forget, tomorrow on Decoding Retirement, we'll be talking with Katie Vitava about Part D prescription drug plans. And we'll walk you through what you need to check so you don't get surprised at the pharmacy. So thank you for watching Decoding Retirement. And remember, you can subscribe to Decoding Retirement wherever you find your favorite podcasts.
This content was not intended to be financial advice and should not be used as a substitute for professional financial services.